In this video, we're going to talk about the 3 stages of retirement benefits. If you're retired before 65, you'll go to the state exchange marketplace to purchase your own health insurance. Using California as an example, it will be the Cover California system. Before you turn 65, you can sign up for Medicare. At this stage, you will need to figure out what plans you want to be on for Medicare, what supplemental plans you will want to purchase for Medicare, and how much Medicare premium you need to pay under the Medicare system. The last stage of retirement medical benefits is long-term care. Today, long-term care can run $10,000 to $12,000 a month in California. The question is, how are you going to cover those expenses? If you're retired before 65, most employers will not provide group benefits anymore, or at least not beyond the 18-month COBRA window for you to enjoy the group benefits. Now what do? You're going to the state exchange to purchase your own medical benefit. In California, we call it Cover California medical benefits. 90% of people who are on Cover California are able to get subsidy for their medical benefits. The subsidy amount is based on your reported adjusted gross income. Many people, even if they have a significant amount of retirement savings and income, they're still able to get subsidy. That's why planning your retirement income at this stage also relates to how much premium you pay and how low of a premium you pay for the same medical benefit. If you're retired around age 65, you have a 7-month window to enroll Medicare. The 3 months before your birth month, and the 3 months after. If you were to miss the window, there will be a permanent penalty imposed on your Medicare premium. At our team, our specialists will work with our clients to discuss different Medicare plans. Do we choose the original Medicare with the supplemental plans, or do we go with the Medicare Advantage? That depends on your doctors you prefer to use, that depends on how often you travel, depends on where you live, depends on what kind of medical benefits you prefer. Another factor in Medicare is IRMAA. IRMAA stands for Income-Related Monthly Adjustment Amount. What this means is your Medicare premium for the same benefits will be based on your retirement income. If you make too much money in retirement, you will be overcharged a higher premium for the same benefit for your Medicare plans. There are strategies we can use that are related to your retirement income planning to help you avoid the additional Medicare premium. Fidelity released a study in 2023. Today, a retired couple at age 65, they're going to need more than $300,000 in their medical care cost. And that doesn't even include medications, medical devices, let alone long-term care. Speaking of long-term care, that is the last stage of retirement medical benefits. Today, long-term care can be so pricey. In California, it can easily go to $10,000 to $12,000 per month. How are you going to cover the long-term care cost when that happens? Traditionally, long-term care can be very pricey to purchase. Traditional long-term care gets into the dilemma of either use it or lose it. What it means is that you pay insurance companies a monthly premium in exchange for the long-term care benefit. But if you never use the long-term care, the premium will not be returned to you nor your family. It stays in the long-term care insurance pool. A lot of people don't like this idea because they never know how long they will need the care, when they will need the care, or maybe they don't even need the care at some point. Here, with TIMLI Retirement Plan, instead of using an expense paying for a long-term care plan, we help our clients structure a multi-purpose plan where that they can insulate their long-term care risk from their assets and their legacy. If you're not prepared for long-term care, if you need the benefits later in retirement, what are you going to do? Are you going to withdraw from your pre-tax account to incur additional income taxes and impact that IRMAA and pay additional premiums for Medicare plans? What if it's a down market? What if the market is down 30%? Are you going to liquidate additional funds just to cover the care cost? What if long-term care lasts more than 3, 4, 5 years? What if you drain all the assets and your beneficiaries and kids won't have anything left? What if you have no legacy because of long-term care cost? That's why having a comprehensive retirement plan is so important. The long-term care plan you have involves all 5 areas in retirement to be planned right.